So if you as a patient go to the pharmacy and you get your prescription filled and all of a sudden you find that it's been switched to a generic, you need to ask certain questions. Number one, for this particular medicine, is the generic exactly the same as the brand name? For some conditions, such as some forms of epilepsy, heart disease, and psychiatric disease, this switch may not be appropriate. Another very important question to ask is there really a generic form of this medication? Because what I have seen with my own eyes happen is that the prescription gets switched from brand to generic, but there in fact is no generic form of the brand medication. This means that in fact the prescription has been switched to a totally different medicine, which may not be appropriate in many cases and should not be done without the doctor's permission. Why would a medication get switched from brand name to the generic? I think that there are several reasons or explanations to make that switch. Number one, in many cases, the generic will save a lot of money over the brand name. They're exactly equivalent, and it's going to save everybody a lot of money. And that's a reasonable thing to do. But in some cases, there is no generic version of that brand name. Therefore, the switch means that the patient is getting a different medication than what the doctor ordered. And the only reason that this is being done is to save money. And it's really unclear who is saving the money. The patient may be saving some, the insurance company may be saving some, the pharmacy may be saving some, but the important point is that it means that the patient is not getting the exact medication that their doctor ordered. Patients need to be aware that sometimes the medication switch can impact their health. For some diseases, such as epilepsy, heart disease, and psychiatric disorders, the switch to a different or a generic medication may mean that the active ingredient is not quite the same and is not quite as potent. And in some cases, the inactive ingredient, particularly for some generics, may cause some side effects or some difference in terms of the tolerability. So it's very important that they know what switch is being made, why it's being made, and the fact that this switch may impact their health, either short-term or long-term. It's very important that if a patient finds that their medication is being switched by the pharmacist, that the patient asks the pharmacist to let the doctor know that there is a switch going on. Myself, as a physician, oftentimes I have seen patients come back to me in the clinic and a switch has been made and I was not made aware of it. In some cases, the switch is reasonable and appropriate, but in some cases it's not. For example, the switch can be made from a brand name to a generic medication that is not the equivalent. It's not the same. So it's very important that patients ask their physicians and ask their doctors whether they've been made aware of the fact that a switch in medications has been made. So in terms of dosage of a medication, it can be confusing to a patient. And one of the reasons why is that doctors oftentimes have different classes of medications that we use. For example, one class of medication we call the statin agents. These are medicines that are used to lower cholesterol. But within that class of statin agents, there may be half a dozen or more different medicines, and each of those may be used at different dosing levels, 5 milligrams a day, 10 milligrams a day, 40, or even 80 milligrams a day. And it can be very confusing for patients because if a medication gets switched within a class, the dosing has to be appropriately adjusted. Otherwise, it could have very significant clinical consequences. In the case of a statin, it could lead to a heart attack or a stroke. So it's very important to have good communications between the patient and the pharmacist and the physician to make sure that if a switch is made, the proper dose of the medication is being used.